We have 325 new COVID-19 cases to announce today. There are 318 people currently hospitalized. Of those people, 82 are currently in the intensive care unit in the hospital, and 56 of those 82 people in the ICU are on ventilators. We are very sad to report that we have 18 new COVID-19 associated fatalities. These people ranged from being in their 60s to being older than 100 years old. Of these people who have passed away, 14 lived in long-term care facilities. Sadly, 2 of these people were residents at the Rhode Island Veterans Home. Both of these residents at the Vets Home were in their 70s and had underlying health issues, 2 of the unfortunate risks that lead to bad outcomes with COVID-19. The administrators at the Vets Home and the Rhode Island National Guard, along with the Rhode Island Department of Health, all have taken a very comprehensive approach to responding to the cases that have been identified there as a result of aggressive testing of residents and staff. The same comprehensive and aggressive approach that I've shared with you that we're doing across all of our nursing homes and aim to do with all congregate care settings. Those steps have included cohorting of patients, bringing the patients who have COVID-19 into one area and the patients who don't into another area. Aggressive symptom monitoring, so making sure that any staff who enter and during their shift are constantly checked for symptoms so that they can leave if symptoms develop, as well as making sure that masking occurs throughout and there is regular, thorough environmental cleaning. But sadly, as we're seeing in other nursing home facilities, in spite of these aggressive and comprehensive approaches, these 2 people in the Vets Home were lost. I want to add that while we honor and remember the veterans from the Vets Home, there are veterans who live at and get care at other long-term care facilities throughout Rhode Island. We want to be sure to recognize and honor all veterans in the state and thank all the facilities that are providing them with the accommodations and care in Rhode Island that they deserve.